Good afternoon or good morning, depending on where you are, everyone. If you're joining us live, today is January 13th, 2022. Happy still New Year. You are joining us today for the official kickoff to our very first SDOH Academy Innovation Showcase, helping health centers build healthier communities. I am Bethany Hamilton, one of the two co-directors of the National Center for Medical Legal Partnership and one of the 18 plus, we're still counting and increasing, national training and technical assistance partners to the Health Resources and Services Administration, and one of the founding partners of the SDOH Academy. Before we begin, I have just a few housekeeping remarks. So, as you all know, we've been on multiple throughout the last couple of years, in particular together. We're using Zoom webinar today as our platform. And by default, as you'll see on the screen, everyone joins on mute. If for some reason the ghosted machine gets us, just make sure you go ahead and hit mute to mute yourself in case anything goes awry today. Also, if you have questions, we will be asking you to specifically submit those questions using the Q&A function in Zoom webinar as opposed to the chat. You are welcome to use the chat to let us know who you are and where you're from, and also chat amongst yourselves, but please to submit questions for the panelists today. We're asking that you utilize the Q&A, and you'll hear from our moderators. We have Catherine Stinton from the National Center, and we also have Eureka De La Cruz from NAC. They will be looking at the Q&A to pose questions that you ask. Also, we know you'll ask, is this being recorded? Yes. And we will be sure to share the slide deck afterwards. So look out for follow-up emails. And then finally, if you do have a need for technical assistance, we have Scott Amico and Claire Grimble, who will be, they're both from Boston University and supporting us today on Zoom webinar. They'll be in the chat. Let them know if you need assistance. So who are we? I mentioned the Social Determinants of Health Academy. As I mentioned, I'm with the National Center for Medical Legal Partnership, and we're one of the 18 organizations, as you see on the screen, that have come together as national training assistance partners to HRSA. We make up the SDOH Academy faculty. You'll be hearing from a few of these faculty members today and during the pre-recorded training resources that we've created, and we'll talk more about later this afternoon. We are a HRSA-funded virtual training series designed to really help staff from health centers and health center-controlled networks and PCAs develop, implement, and sustain SDOH interventions in their clinics and communities around the country. We really want to thank HRSA and the Bureau for Primary Healthcare for their continued support and their vote of confidence in our ability to truly deliver a brand new way to effectively and increasingly make our training and technical assistance opportunities more accessible to the health center and to their stakeholder field. Okay, so why are we here? After my brief introductory remarks, as you'll see on the screen, you'll be hearing from Eureka De La Cruz from NAC, the National Association of Community Health Centers, and she'll be introducing Dr. Hassan Batts. Dr. Hassan Batts is the Executive Director of Promised Neighborhoods of the Lehigh Valley. Eureka De La Cruz is going to be properly introducing him during her remarks. Finally, when we wrap up Dr. Batts through his keynote speech and a Q&A, so don't forget, use the Q&A function to submit questions to him. He is our special guest. You'll also be hearing from our other special guest, Colleen Velez of the Corporation for Supportive Housing and Tanisha Harris of the National Healthcare for the Homeless Council. They'll be letting you know more about the Innovations Showcase competition, what we hope you will all partake in after this kickoff webinar today. We'll open up for Q&A about the competition, and then I'll finally close this out, because as soon as I close this out, that's when we're kicking into high gear, which is the next phase of this entire interactive training experience. That's the modules and then the competition itself. Let's do a little bit of level setting. Who are we? Who are health centers? What is it that makes this provider type so unique? Why is it that we call on health centers specifically when we need to meet both the health needs and the social needs of our communities around the country? You all remember the late, great Dr. Geiger, one of the co-founders of the Community Health Center movement. Back in 2017, there's a link to this video many of you all have probably probably seen before. Dr. Geiger correctly observed and predicted that we were again paying attention to the root causes of what makes people sick, and health centers would have a new life in that social and environmental intervention as a part of their work that characterizes community health centers at the beginning. That's what characterized health centers at the beginning. SDOH interventions and upstream innovations are what make health centers so unique and relied upon as trusted partners for communities across our country. And addressing the social determinants of health is in our DNA. This is who you are, health centers and partners tuned in today. This is who we are. Do you need the evidence? Case in point, here's a quote from a clinician, Cheryl Yoshimura of KKV in Honolulu. She said, during COVID-19, the community health workers specifically became the drivers so that they would pick up food and deliver that food to patients' homes. Those were services that they had picked up and carried out before the pandemic, and they knew would need to be continued to address food insecurity and housing insecurity in their communities. Next example, a quote from Selenia Gonzalez, an MHP Salud CHW. As she noted, we are successful in our work because we are able to communicate with our participants in their preferred language and take the time to explain and answer any questions they may have and can refer them to services accordingly. Next quote, again, and I just want to shout out all of the CHWs around the country who tuned in today. You'll see another quote from Alida Perez, another MHP Salud community health worker, who's with the program Vivir una Vida Plena, which plays a big role, as she said, in the lives of their participants. As she explained, after attending that program, she sees the changes in participants' motivation to make those lifestyle changes related to diabetes management. She says it's very satisfying to see their growth as they incorporate what we've gone over in their sessions, such as nutrition, stress management, and physical activity. This is who you are, health centers, and all of those who are joining us today to support that work, the PCAs, the HCCNs, civil legal services partners, social workers, and other stakeholders around the country. This is who you are. It is in your DNA to address the social determinants of health. Without further ado, I want to pass the mic on to Eureka De La Cruz from the National Association of Community Health Centers, so you can hear from our special guest who's delivering a keynote today, and we'll be talking more about his work with health centers in this community. Eureka De La Cruz, passing the mic to you. Thank you, everyone.
Thank you, Bethany, for setting the stage and that amazing introduction for all of us. Again, my name is Eureka De La Cruz. I'm the Program Manager of Social Drivers of Health at NAC within the Public Health Priorities Division here. So I'm really excited for all of you to meet an amazing person. I was very fortunate to have met him when I decided to do my practicum, my MPH practicum at the Neighborhood Health Center of the Lehigh Valley, and he was my preceptor. And while during my time at NHCLV, we worked together on some really amazing work. And since then, we've stayed friends and colleagues and peers. And so currently he's the executive director of the Promised Neighborhoods of the Lehigh Valley. And I'm one of his board members. I joined end of 2018. And one of the things that we've always talked about, and one of the things that I really appreciate about Dr. Batts is that he has this very unique ability to work with individuals from throughout the community. So regardless of their journey, he really engages them in a way that's very powerful. So I'm really excited to have all of you get a chance to hear from him, to learn from him. And yes, I'm just really excited to pass things over to Hassan.
Thank you, Eureka. Thank you. It is a pleasure to be here and to be introduced by you, Eureka, right? A former student, and just how the relationships grow, man. So I see we're starting with quotes. So I have a quote for this work. Jay-Z said the genius thing that we did was we didn't give up. And today we're going to talk about this idea of innovation being revolutionary, this idea of innovation being courageous, and the fact that we're here is that we didn't give up. And my story starts. The reason I'm speaking to you today is because I stand on the shoulders of the elders and the ancestors, the people that came before me that refused to quit. And this whole movement also does that, right? I walked into a health center and I applied for a job as a prison survivor. The moment I walked through the door, there were people that looked like me smiling at me, that said to me that I'm welcome, that said to me that I'm welcome, that said to me that I belonged. I met with the medical director, and my email was justequality@yahoo.com, which often lost jobs for me. She asked me about my email. She inquired, and we had these conversations. She did something different. So when we talk about innovation, the challenge of our moment is to do something different. The challenge of our moment is to be courageous. We talked, we met, we built. She wanted to offer me the job. She offered me the job, and then I sent forward my background that I had already told her about. And within the organization, there were some challenges to my background, to hiring me. The reason I'm standing here before you today, speaking before all of these federally qualified health centers and these health centers, is because the medical director chose to challenge the policy on hiring prison survivors. She chose to do something different, saying we can get different outcomes if we do something different. So I started to work at a health center, something that I identify with. As I shared, I stand on the shoulders of the elders and the ancestors, right? So we start with Mama Bats to tell you that story. I was a super utilizer. So that's what helped me connect with the work. That's what helped me understand the value of healthcare, right? And that's the language that they use, super utilizers. I had childhood asthma, and every weekend would end up in the hospital. Every weekend. So I understood this need of not being able to breathe. I understood this need for people that understood and cared about me. And what I also understood was the idea of having someone that believed in me, because my mother believed in me through the suspensions. Mama Bass believed in me through the arrest. She believed in me through the hospitalizations. She believed in me that I could be more and had more in me. And what does this have to do with this conversation with health centers, right? Because my mother used to tell me that if I put half the energy into doing the right thing that I put into doing the wrong thing, I could change the world. She said, if you put half the energy into doing the right thing that you put into the wrong thing, you could change the world. What does this have to do with health centers? We understand that every child needs that one caring adult. But what we don't talk a lot about is that every adult needs that one caring adult and that one caring space where they always feel welcome. Every adult needs that one caring space where they always feel welcome, because none of us get here alone. And the health centers have the opportunity to be that space where we practice trauma-informed care, where we practice restorative practices, where we practice equity every day. This is what we do. It's in our DNA. Innovation is in our DNA. And we are the ones that can do something different. And we are the ones that can be courageous. And it's in our DNA. So for the folks that need more of this linear idea of what is this guy going to be talking about, we'll come up with some learning objectives, right, that are identified. So we got 3 learning objectives that we're talking about. One is, right, that everyone needs that one caring adult and that one caring space. The other, you already know, is that accessible and affordable healthcare is a basic human right. And we say that accessible and affordable healthcare is a revolutionary act, and that by design, health centers are revolutionary. They're centered in resistance, at least a form of resistance, right? And that you don't need permission to do that. And that innovation is about failing forward, and that we come from communities that oftentimes don't have the privilege of failing forward. Because we have these pressures, we have this urgency, and that white supremacy culture has taught us that we can't make mistakes. But innovation is about making mistakes. It's about having the permission to try something different, because we know that these systems are broken and that they need repair, that the answers lie with the people that are there every day, the people within community that have the voices. The third thing I'll say we'll talk about is that healing occurs in authentic relationships and within community. I always say that. Healing occurs in authentic relationships and within community. And there's this understanding that at the organizational level, we need authentic relationships to get this work done. We need authentic relationships between our patients. We need authentic relationships with our staff. We need authentic relationships across organizations and across sectors to have this collective impact that is required to really improve and move the needle on community and population health. So I'm the executive director of the Promise Neighborhoods of the Lehigh Valley. The Promise Neighborhoods is a Black-led, anti-racist, liberation-based grassroots organization that is centered in wellness and healing. And we do this through leadership development, violence prevention and reentry, racial justice and health equity, and community capacity building. I once worked as a social worker at a federally qualified health center. And in the work that we do today, we're talking about community partnerships, right? And how do we get there from a space of innovation? Every program we have is partnered with a community health center. Every program we have, everything we do to move forward the needle, we know that community health centers, that federally qualified health centers are critical in the work that we do. So we have authentic partnerships and authentic relationships. And we'll talk today about what that means, what they're grounded in, what are some of the principles, and what is some of the research behind it, right? So we have the neighborhood health centers of the Lehigh Valley, the one that I spoke of that I used to work at. We have a champion there that steps into every project, provides support, and partners with us. Then we have an organization called Star Wellness, which I'm actually a patient of, and also one of the folks that we've been developing is on the board. So there's this notion of when you're looking for board members to meet the requirement, that's not the person of privilege. These are the people from the community. Like, we don't cut corners in getting community voice and bringing on community voice and empowering community, because this thing is built upon community empowerment. That is how community health is going to improve, through agency, through belonging, through increasing hope, through community empowerment. And then we have Valley Health Partners, again, one of the folks that we've developed through our health advisory committee at Promise Neighborhoods. It's on the board of Valley Health Partners. So we ask ourselves, how can we be good partners with community health centers? And they ask themselves, how can we reach into grassroots Black-led organizations and find folks to help to drive this work home? When they find themselves with challenges and they need answers, they pick up the phone and they call their partners who are connected to community. So how do we ask ourselves, what community organizations are we connected to? Our work for improving our patients' health has the clinical component to it. And then there's also this idea of, who are the folks in the community that are really driving our work? Who are the experts that we are tapping into? We have a Permaculture grant in partnership with FQHC, two FQHCs actually, that's looking at how do we bring context experts, folks with lived experience, folks that are often ignored, underlooked, together with the content experts to share stories and understand how we can work together to bring about the changes that we need in healthcare. And then in addition to that, right, when we talk about this idea of collective impact, none of this would be possible without bringing in the funders and really bringing the funders as authentic partners into these conversations. Let's go to the next slide, please. So Radical Welcome has healing powers, right? And we're talking about, next slide, how do we use this idea in the places that we show up every day? How do we normalize this idea of radical welcome? And when I speak to radical welcome, again, let's remember I'm talking about it from a trauma-informed space. So even when people don't show up as their best selves, how do we continue to invite them? How do we continue to smile? How do we continue to recognize them? How do we continue to see all of the assets and the strengths that they bring to the table? And how do we begin to do something different and ask ourselves, how are we different from the systems that are harming people? What is it that we're creating? Next slide. So things we say to consider, right, is that increased protective factors and non-traumatizing spaces are the ones that are going to provide a space for our communities to thrive and heal. We know that we work with the most vulnerable populations, the most oppressed and marginalized, and what our experiences are every day. We all know what it feels like to be rejected. We all know what it feels like to be pushed out. We all know what it feels like to be kicked out. I was left back in kindergarten, and that's not an isolated story. The messages that we're constantly bombarded with, how do we create spaces? These are some of the things we focus on in our partnerships and at Promise Neighborhoods. How do we create spaces that every time people enter and engage with us, we're building and empowering them as protective factors? And we know that healthcare workers are recognized as one of several of the most trusted professions. So how do we maximize that and use the opportunities that we engage with people to let them know that they are enough and that they're better than the most challenging experiences that they've had. Next slide. So we're gonna go through, I'm gonna show you what some of our folks look like, right? Because we look like the community that we serve. And if you were to look at our organizational chart, at the top of the chart is the community. Then comes the board, then comes the executive director, et cetera, et cetera. But the community drives the agenda. The community makes all of the decisions. The community, we have responsive programming, so we're not going to open a media lab unless the community asks us for a media lab. We're not going to do a food wellness space unless the community asks us for a pantry. I mean, we're really built on responsive programming. And how do we demonstrate belonging? We demonstrate belonging through everything we do. Who shows up, who works there, represents the people, who are the decision makers, what the board looks like, et cetera, et cetera, et cetera. Next slide. And we let people know that there's a space that they can be the change. We use a model. We use a couple models, right? But one of the models we're going to talk about today is the radical welcome engagement and restoration model. And it begins with a passionate invitation. What does it look like to make an individualized invitation to let people know that they're welcome, that we need them, that they bring something, everyone has something to give, and that we're here to receive it, that it's not just about professionals. There are no layers within our health systems. There aren't the community health workers and the nurses and then the physicians, and the patients don't have voice, but we invite them to be a part of it. We invite them to contribute to it genuinely. And then we really bring forth this radical welcome idea, authentic sense of belonging. We know that everyone wants to bond to something. Everyone needs belonging. Co-created roles. What are the skills that you bring? What is it you want to contribute? We had one neighbor that she used to hand out flyers for us to the young girls on the block because she sat on her stoop all day long. She sat on the porch. So we partnered with her, and she's still with us to this day, volunteering at the health center and at the organization that I run. And again, prioritizing the social issues. What does it look like for the community to really drive forth and prioritize what the issues are? And none of this is new, right? This is just a reminder to do more of what works, to do more of what you already know, to really go back to the heart and the DNA of this movement that we're a part of, an individual and collective action. We know that advocacy is required, and partnering with advocacy organizations within our community is what's going to move these things forward. Next slide. So there are a couple of different pillars to this work. The first is, it may be the most important and the most difficult for us, is to relinquish power. When we're engaging with the community, we have to relinquish power, especially as historically white institutions coming into spaces of color. We have to relinquish power, we have to relinquish voice, and we really have to be present and respond to the needs of the community. And we'll cover a few more of these: authentic engagement, restorative practices, equitable compensation, and shared accountability. Next slide. So in our slides, you're gonna see what we do. We eat together, we play together, we smile together, and we enjoy each other as we develop, again, this idea of authentic relationships. So we have to acknowledge and relinquish power. We have to recognize our status. We have to recognize where we hold meetings, how we hold meetings, who comes to whom and when and how, and be very cognizant and honest about it. We have to be transparent on what our agenda is, and that the community sets the agenda, and we have to relinquish that and relinquish power. We also partner with universities on all of our projects, right? So we're partnering with health systems, we're partnering with federally qualified health centers, and we're partnering with universities. And these are much larger institutions that come to the table, and the first rule at Promise Neighborhood is you have to relinquish power to work with us. The only way we get to equity is not all tides, the tides lift all ships, however the saying goes. We get to equity when the people at the top, when the institutions at the top relinquish power, and it empowers the community voices, because the people with the lived experience, those that are closest to the pain, have the most intimate and most ignored solutions. Next slide. Authentic engagement. We spend time with people, we listen to them, we know their names. I talk to the staff and I say, if you're not going to funerals, if you're not at the birth of children, if you're not at marriages, bar mitzvahs, you're not a community organizer. You're not a part of the community, right? What does it look like? And we know that budgets are value statements. So when I worked at the health center, the director gave me innovative space. Innovation is courage, right? Innovation is revolutionary. So these weren't billable hours. These were hours that were invested in the community, hours to engage with people in the community, to find out what they needed, to build these relationships across sectors, across organizations. And it really took this investment from the leadership in it. So what does it look like to engage, to give time to people to engage with the community, to build that into our design, that someone is going out, that someone's attending meetings, someone's walking down a block, someone's talking to people, someone's showing up at schools to say, what's important to you? Hey, nice to meet you. This is who we are. This is what we do. And then amplifying those voices and creating space, opening doors. I mean, ultimately, many of us are gatekeepers. And the question is, what kind of gatekeepers are we going to be? Are we going to do something courageous and revolutionary and rip the door off its hinges? Or are we going to continue to do business as usual that presents the health outcomes that we currently see? Next slide. And it comes from a place of really being asset-based and recognizing that my wife is a farmer, and she always tells me, she says, your work is permaculture. You know, that recognizing that the community possesses everything that it needs to be self-healing. It possesses everything that it needs to be self-healing. This is permaculture idea. Next slide. And this one is difficult for folks. One of our principles is that equitable compensation for community partners. Everyone is compensated for the work that they do because we recognize their expertise. So not just our clinical partners, not just our research partners, not just the administrators that work with us, but we compensate the community at a level that maintains their dignity. And when we're working with larger institutions, they understand that the smaller organizations have to be compensated. And it's oftentimes a struggle because it's a different way of doing business. And we know from the health center model, I can't reiterate it enough. It's in our DNA to do things in a different way. Next slide. Again, you see every slide, you see, the people that they say they couldn't find at the table. It's interesting, when I tell the story of Promise Neighborhoods, when we started, our board was all white. Our board was all white. We had two people of color actually on the board. And we continually hear across our community that we can't find people of color. We can't find our people that want to serve on boards. We can't find volunteers. We can't find nurses of color. We can't find teachers of color. We can't find physicians of color. And I live in a community that's 70% people of color, like 66% Latinx. And my response is, the only way in my community that you can find an all-white board, it has to be intentional. For you to have a board of all white males over the age of 60, it has to be intentional, whether it's explicit or not. That's the only way that you can do that. And it's time for us to do something different. And that comes from a place of abundance, right? Not scarcity. The people exist, you're just not in relationships with them. And once you're intentional about that, then you'll begin to form those relationships. When I started at Promise Neighborhoods, we'd look around the room and we'd say, yeah, you have a room full of color, but it's full of Black males in a majority Hispanic community. So I had to intentionally change that. I had to intentionally go and join communities, speak to leaders, engage, find out what was needed, make sure that barriers were removed, to now where we have a staff that is predominantly Latinx, predominantly Spanish speaking, and reflective of the community that we serve. So there's this question of accountability. We constantly want to collect from the community. We constantly want to have the community be accountable to us. How are we accountable to the community? And how is that communicated? I mean, we find ourselves in situations where if you miss 3 appointments, you get fired from a practice, but when appointments are double booked and you have to wait for 45 minutes to see a clinician, what does the accountability look like? We offer and we expect grace, but we offer grace first. What does it look like to understand that institutions are living organisms and that in every interaction, we have the opportunity to strengthen our bonds and our relationships with our community or to sever them? because the narratives carry, the experiences carry. I get my care at Star Wellness because my daughter told me to get my care there because she was getting her care there. And she sent me there. The narratives carry. The narratives carry. Next slide. The way we treat people matters. So, like I said, we use a model called the Radical Welcome Engagement and Restoration Model, built on this theory, this idea, right? That just as you have voter suppression, we have something called engagement suppression that exists in our society, where we say we want all the parents to show up. But imagine if every parent showed up to the school and shared their ideas. Nobody wants that. We say we want patient feedback, patient satisfaction surveys, but do we really want to hear patient voices? We have to create an environment where we authentically want to hear patient voices, where we authentically are allowing patient voices to drive our work. So the model recognizes that engagement suppression exists. When people begin to show up, we oftentimes don't listen and we put barriers in place. So what does it look like to have an institution, an organization that is built on those relationships, that knows that healing occurs in authentic relationships and within community, and that organizations have to have relationships across the community, that organizations have reputations that have to be nurtured, that can't just be expected, that organizations have to be accountable to the community. We have to answer for the decisions that we made and the poor decisions we've made and the mistakes that we've made. And we have to seek forgiveness. There's a lot of research right now that talks about sincere apologies, but our privilege prevents us from apologizing when we wronged our community. Our privilege prevents us from looking at the historical issues that have occurred. I mean, and I'm preaching to the choir here, right? Because the American Medical Association has stepped forward and said, as well as other medical associations, that a long history of being steeped in a medical apartheid and historical trauma has occurred between communities of color and these institutions. But how are we on a local level looking at what we've done before we begin to chastise people for not being vaccinated? How do we approach this and say, we know that we've done harm. We know historically we've made mistakes. We know that our staff is not reflective of the community in which we sit. We know that we can do a better job. And we sincerely are telling you that we are concerned for your healthcare. Next slide. So our work is centered, and you should have an article that came to you from that speaks to the model, some work that we do. Our work is centered in equity, and we support it through this idea of community-based participatory research, right? So everything we do, again, we partner with health systems, and everything we do, we also have a resident researcher from a local university that we partner with to help us to make sure that we are really impacting the canons of knowledge. Because for us as a grassroots organization, a relatively small grassroots organization, means that we have to change the way in which people are being taught. We have to change. We work with physicians every day. We work with nurses, students, and we hear this idea of nurses eat their young. We hear this idea of residencies or medical school and residencies are torturing people, right? And we want people to be perfect, whole, and complete as they step into this work, because we know many of us are wounded healers. Many of us are wounded healers, that we chose this profession to give back to the world, and that the way we treat each other will impact the way that patients are treated, will impact the way that family members are treated. And when we think about the violence and the pain and the suffering and the diseases of despair across our community, we have an opportunity to say hello. We have an opportunity to smile. We have an opportunity to say it's okay. We have an opportunity to say, this guy has a record. He sent us his record. He's paid his debt to society. He's gone back to school and developed himself. Why can we not hire him? Where in the policy does it say that we can't hire him? And if so, why? So my challenge to you is to be innovative, which also means to be courageous and to push this revolution forward, man, by doing something different. When you have the opportunity to say yes, when you have the opportunity to ask why, when you have the opportunity to say hello, I mean, it's sad that in this day and time, hello is a revolutionary act. Thank you is a revolutionary act. But at health centers, these are the spaces that people should feel welcome. So we serve at our community, 120 people in our community, right? And we asked them, where are the places where you feel most engaged? Where do you go when you feel valued and where you feel listened to? Work, friends' houses, homes, pediatricians, and doctors' offices. Consistently, we hear this, that the doctor's office is a place that I feel welcomed. We have to maximize the opportunity that there is trust that exists, and there's huge distrust, earned distrust, but there is the opportunity for trust that exists as we engage with people to really push the needle on health and life outcomes. Next slide. So we are going to go into a fireside chat with Eureka and I'm looking forward to it. Please ask questions. We are here for you guys to ask us some questions.
Dr. Batts, oh wow, that was amazing. I'm just so grateful. I'm glad we get to share this space together. I'm glad I was your student and now one of your accomplices, if you will.
That's right.
I guess I just want to start off with a couple questions and then we'll jump into what questions have been submitted. And actually one of them is aligned with the question that I had. So one of the questions that I have that I see in the chat here or in the Q&A box is, how do you care for yourself in doing this work? And then I'll add to that and ask, how do you care for your staff and make sure that your staff remind themselves to take care of themselves?
How do I care for myself? Man, I don't want to butcher this quote, right? That says, oh man, I think it was the late great Bell Hooks. Someone correct me if I'm wrong. And Audrey Lloyd said this, right? The quote is that self-care is not an act of self-indulgence, but it's a revolutionary act. So it's centering my self-care with that. Self-care is a revolutionary act. And someone asked me one time, what if I love my community. I love my community. I pour into my community every day. I wake up thinking of how can I fuel and feed this community? And someone asked me one time, they said, what if, it was Elder Phyllis Alexander. What if the most powerful thing you could do for your community is care for yourself? Think about that. What if the most powerful thing you could do for your community is care for yourself? Because we are healers and helpers. So we'll accept that. And that's the charge. The most powerful thing that you could do for your community is care for yourself. And that means whatever it means for you. That, my wife wants to pop open some wine and watch Scandal. Some folks need the roses and the candles all around. Some people need to hit the gym. Some people need to garden. Whatever it is, you have to find it and you have to do it, because it is a revolutionary act. And I keep using that word because everything we do is about revolution. So how do I care for my staff? That's a big part of it. It is written into our DNA. It is an expectation. To a certain degree, you're evaluated based off it, right? Like that is probably the most important thing that you're doing, and we're constantly checking on each other. And one of the critical things that we do, and you'll remember this, Eureka, right? We talk about self-care and compassion, self-love, and team care, compassion, and team love, right? We want all of you to show up. So I often say, if my child, may Allah not ordain, has leukemia, I don't have to leave that at home. I'm part of a team where I can come and where I can say, I'm struggling at home, Johnny's not doing well, and they recognize that. Take a moment, do what you need to do. And compassion doesn't remove accountability. I still have a job to do, but so we have a team with this authentic relationship. So people, with all of you show up. We don't say, leave that at the door and this is work. Nah, we recognize that you are a human being and we want all of you to be present, and health centers have that ability to really push that forward.
Yeah. And I remember when I first started working with you, I was going through a difficult time and you were asking me and checking in on me, and I was pushing it back because it was the first time I was seen. It was the first time I was heard in a professional setting where I felt someone cared for me. And so I guess my question is, how do you continue to care for people when they when their walls go up?
That's when that trauma-informed care piece kicks in, right? Understanding context. Understanding context. So I know the history of America. I know the history of this world. I know the current conditions. And I recognize the lives that we live and what we're exposed to, right? So this is part of answering your first question too, and this question together. The other thing that I do is I surround myself with people that love me and believe in me. I have people that nurture and pour into me, man. So I don't want to make it sound like I'm just pouring and my cup is empty. You know, I surround myself with people that really support me, which is evident in our relationship. My board is phenomenal. And I'm not just saying that because I have a board member on here. You know, I started when I stepped into the organization, it was an all-white board that many were disconnected, loved, and very passionate about the organization. But they immediately recognized as I was turning the ship and pivoting that they needed to make space for people that brought a different skill set. So my board is all people of color, right? They're all folks that are involved and engaged in this work and understand what I'm going through. And they check on me, they care for me, my staff cares, we care for each other, my family, my friends. And I've been blessed to have my avocation and my vocation aligned. So when we think about that mission work and that passion, it's critical. So when people's walls come up, I mean, I understand the pain, I understand the privacy, and you just said it. You know, it's the first time that you've been seen and heard. So we have this practice, man, when we follow the Messiah people, I think it is, that said, I see you, you know, and this is explicit. We make these things known. You've heard me say these many times. When you come into my office at work, behind me, right, it says, I am because we are.
I was just gonna say that.
Right? You know who you're dealing with. Yo soy porque nosotros somos.
Yep.
You know that as soon as you walk in the organization, right? You know that we are each other's medicine. Like there's certain things that everybody's gonna hint that's invigorating, right? Because I believe in public health campaigns. So you walk around our city, you're gonna see everybody with this shirt on. I believe in movements, and movements are made through mantras, through call and responses, man. That's my people's way. That's our people's way. So that's how we do it, right? So when people put up a wall, I understand that, I'm patient. And your story is yours. We believe that healing occurs in stories, but that's only, it's like an onion, right? I can't force it. You have the permission to give me, that's what agency is about. If you don't want to share it, mashallah, I'm still here with you. That's a long answer. I gotta give you shorter answers.
So we have a question from one of the attendees, and they asked, how do you approach leadership when a funder is involved with political activities that hurts the community they serve?
How do you approach leadership when a funder is involved in political activities that hurts the community they serve? So I started with a Jay-Z quote, right? So I'm from Brooklyn, and I'm from the Brooklyn of the 80s. So this term offends some people, but I'm from the hood originally. And the first thing that comes to my mind is all money is not good money. So there are funders that I don't accept money from, you know, and that shocks people. There are people that call me with some money and I say, no, we don't want that money, man. We're good. We're good. Like I'm not gonna sell my soul. I'm not gonna sell my staff. I'm not gonna take money to, and you know, that's gonna, we're not gonna be in a relationship where you're harming my community. And I'm not saying, right, there's a continuum to that. Anyone that I'm in relationship with and I receive money from, it's gonna be about education, right? So most funders are doing harm. We have to decolonize philanthropy. I mean, that goes without saying, but somebody that's like intent on doing harm to our people, man, like I can't be in relationship with them until, again, right, they relinquish power and they're ready to become a student of ours. I mean, this, you know, yeah. Dr. John Henry Clark said what? He said, I debate my equals, all others I teach. So when it comes to this thing about community building and Afrocentrism, they're not in a position to debate with us. It's like, let's come together and let's build, man. Let's build community, but you got to recognize that these people know what they need. Because it's not me speaking for the people. It's putting you in I'm putting 16-year-olds in the room on boards. I'm opening doors and saying, listen to them, listen to the people. So if a funder's hurting the people, man, like, I don't know. It's a hard place without the context and the specifics, but
yeah,
we have had to take funders away.
Yeah, I was going to say that I appreciate that in working with you and partnering with you, seeing you navigate certain relationships with some of our funders, and I say our because I'm a board member of PNLV, and navigating some of those situations and kind of calling in, not calling out, but calling in certain situations or certain practices and really saying, well, this is the impact this is having on our community. How can we move forward so we're not causing harm?
That's right.
I think a lot of times, a lot of people inherit all these practices without really knowing where they came from. And this is just how things have always been done. And this is where we get to, be courageous and kind of think of more critically and really challenge that in a way that says, well, if it's causing harm, how do we find a more restorative way of doing things?
Yeah, so you spoke to something else, right? I have a board that loves me. Like I have people, and I don't make decisions in isolation. So I don't just sit in a room and say, oh, no, we're not taking their money. I call people and I text people and say, yo, what do you think about this, man? Like, I don't feel right with it. What is that journal, Stanford Social Innovation?
Mm-hmm.
Just yesterday, I got a link from Jill Pereira at our local United Way, where she quoted a conversation we had 6 years ago. In it, check it out. It's from Jill Pereira at the United Way. She quotes the promised neighborhoods of the Lehigh Valley. She quotes Hassan Batts, and she says, and this was when we were young, we didn't have no money. I'm filling out a grant application, and it said, for some neighborhood leadership programming, how are you going to develop people to join all of the movements and activities that are happening within the community? And I struggled with the response. So I said, I'm not going to bed selling my soul for this response. And I said in the response, this question is not centered in equity. This question does not recognize all that's occurring within our community. And I jeopardized losing the grant, right? And she talks about that. She talks about how she called me in and we talked about it and how she's grown and our relationship has grown and that trust for us has grown to where now it's published in the Stanford Social Innovation. So sometimes those challenges with love, right? Because I believe in Eureka, nonviolent direct action. So I'm not talking about nobody's mama. I'm not saying nobody's name. I'm talking about issues, right? I'll write an op-ed to the newspaper. I'll get online, but I'm not going to attack an individual. So they know that he is approachable. And what I'm going to say to you is you need to meet Jose. Let me introduce you to Abuela, because that statement you're making is harming people. That practice is harming people. Let me introduce you to a community of context experts that can impact that.
All right, so the next question is, how can folks without power within their organization push leaders to be more authentically focused on equity, innovation, and justice? So again, how can folks without power within their organization push leaders to be more authentically focused on equity, innovation, and justice? And it kind of reminded me of something, so I'm gonna pop in and then I'll see what you have to say. That question reminds me of Millie and how she has the walks, the neighborhood walks, and she invited people. So Millie's a community member in Allentown, and she does walks at 2, 3 a.m. in the morning in really, tough neighborhoods. And she's invited people from, I think it was a local police department, just so that they can learn more. And I remember that being very powerful in terms of, a lot of times leaders don't understand the why or any of that. So it's kind of like, well, let's go for a walk, right? And that's kind of the first thing that came to mind when I saw that question. I'm not sure what came to mind when I asked you that question.
Yeah, when you asked me that, I thought about a couple things, right? One is this idea of the quadruple aim.
Mm-hmm. So
for years we were all fighting this triple aim that we could bend this healthcare cost, if we just put in the triple aim into practice. And then the idea of the quadruple aim came out that says, if you take better care of your staff, essentially, right? To paraphrase it, if you take better care of your staff, it'll improve patient outcomes, it'll cut costs, it'll decrease errors, all of these things, right? So we really have to take better care of people, and we have to take better care of ourselves, and our leaders have to take better care of themselves, and the people above them have to take better care of them. So I have this notion that frustrates people, right? They say, oh man, you talk this revolution stuff, but then you say something about compassion for the oppressor. Because I recognize oppression is killing them too. You know, so I do believe that our leaders go into this work because they want to do good and they want to bring about change. And these systems crush people. So I start from a place of compassion, right? But I also know that we all hold power, especially collectively. I've seen it work from being a 12-year-old on a small block in Brooklyn that had to walk to Albany projects to get to junior high school, that collectively we could bring about a change, to moving the needle with the largest employer in our community, that collectively we can do this. So if you're alone in an institution and you're wrestling with bad treatment and bad habits, that's a hard place to be, and isolation kills, right? So sometimes we have to leave, and yeah, sometimes we have to leave, and it's not running, it's self-care. And I don't know the circumstances. The other thing I thought of was Ron Dendis from the writer Pool Foundation would always say to me, gentle pressure applied relentlessly.
Yeah.
Gentle pressure applied relentlessly, right? So Maslow says if the only tool you have in the toolbox is a hammer, everything begins to look like a nail, right? So we can't always just smash the doors open. Sometimes it takes conversation. Sometimes it takes sending some articles. Sometimes it takes, you know, hey, I heard this keynote. Let me share this article with you. I want to start this lunch and learn. You know, sometimes it takes stepping into a leadership position, and we've all struggled. We've struggled together before. You know, we've all struggled with it. But sometimes you got to leave.
Yes.
One thing that I've learned is I will not be complicit in my own oppression.
Yes.
You don't have to tell people that it hurts when they punch you in the mouth. So I'm not going to be in those relationships. But I have the privilege to be there, right?
The next question we have is, how, in your work with community members, how have you worked with them in order to come to a consensus on what they want, or how they, what they feel are the priorities for the community?
A consensus, huh? Man, we just try, right? We spend a lot of time listening. All of the staff live in the community, are part of the community, are really ingrained in it. Active listening. That's it. And innovation, what we're here to talk about. We try programs, and you know, this idea, if you build it, they'll show up. You know, when they don't show up, we say, what can we do differently? And we re-engage again. We do a lot of focus groups, we do a lot of interviewing, we receive feedback. And the people come in droves if there's an interest. You know, and we tweak things. So it's this rapid prototyping. Like, man, we pivot very quickly. When COVID hit, all of our anchor institutions froze. The whole community froze. And we even froze for a couple of days, right? Because we're like, you know, I consulted the elders. My grandmother's 85 years old. I call my grandmother. I call some of my other elders, Elder Camilla, who you know, Elder Walter. What do we do? They're like, I have no idea. I don't know what to tell you. So we didn't even know what to do. We didn't have the elders. The team is looking at me for leadership. And it's a strength of leadership to say, I don't know. I had to say, I don't know. The elders don't know. I'm digging through the research. We don't know. So what did we do? We went out into the community and we asked. We just asked people, what's going on? What do you need? How do we need to respond? Thinking we were going to be responding to COVID. And what we found out was, if you remember back to when COVID first hit, toilet paper was out. Toilet paper was out everywhere. And what we found in our community was people needed diapers. I don't have a baby, right? But diapers are the toilet paper for babies. And parents were stressed. They couldn't get diapers. So what did we do? We gave out 200,000 diapers. And the staff, I was constantly telling the staff, even when COVID first hit, we are not a crisis agency. But what I learned, so I'm still answering the question, right? How do we respond to the need? How do we come to consensus? What I learned is that during times of crisis, crisis is justice. Because I would say we're about justice, not crisis, right? Not charity, excuse me, not charity. We're not a crisis agency, but we're a justice agency, not a charity agency. But during time of crisis, charity is justice. So I learned by being surrounded by people from the community. I learned by having them be in relationships and talk to people in the community. And I learned by really listening and trusting and believing in my staff. The further we get removed from boots on the ground, to boardrooms, to dealing with funders, to PR, we need to really trust the people that are boots on the ground that they know what's going on day to day.
Yeah. And it was really, really admirable, inspiring, but also a little bit heartbreaking when, when I think about the staff that really was in the field, was really in people's homes, delivering the diapers, the foods and all that. And these are people that are typically thrown away. These are people that were typically, people that are returning citizens. They've been previously incarcerated, and yet everyone had the privilege to stay at home and stay safe, but yet they came and they answered the call to serve the community. So I just wanted to just reflect that.
Yeah, thank you, right? We're talking about Latin Kings, Bloods, and Crips working side by side. CNN came out and did an article about it because it was like so groundbreaking. They're working side by side because they said our community needs us. There was no violence during that time, because they rallied together. Because these are folks that have been working with us, being developed the whole time, and they're like, we're showing up. We are the ones that drive this community. So the work that we do. The reason I could sit here before you, right? I went back to Mama Bats is because she knew that I had these leadership skills. When the schools ignored me, when the schools pushed me out, exactly what you're talking about, she recognized them. So how do we recognize those in other people so that when challenges present, we got the people with the natural leadership skills to show up. If you guys look back to, you can see this. Oh, okay, perfect. Thank you, Bethany.
Yeah, she dropped in the CNN article.
Listen, this team is amazing, man.
Yeah, we are a great team.
Seriously.
I'm scrolling through the questions and I'm trying to figure out how to put them all together. But this question is a really good one, and I want to make sure we have time for it. What have been some challenges of working with health centers, and how have you bridged those partnerships? So in your work and leading PNLV and all the great efforts, what have been some of the challenges in working with health centers? And what have been the steps or the strategies that you've used to really build those bridges or overcome those gaps and challenges?
I would say the challenges are when you work with any institution, there are so many obstacles and barriers that exist, but particularly in healthcare, right? Healthcare and education, well, and criminal justice, all the sectors, I guess. But we bridge them through finding champions. Mm-hmm. We have to have champions, and it goes back to relationships. We got to be in relationships with people. That trust us, that speak for us, that advocate for us, that see something in us. So as a small, grassroots organization, that is about advocacy, oftentimes, right, and activism. People don't want to put their name next to ours sometimes because they don't know if I'm going to say F the police, right? But with time and enough successes, they've learned this guy's going to be a good steward of our name. So the challenge of this moment is like the speed of trust that everybody sees. So it's poco un poco, right? Like we just got to have these little baby steps. We got to do little things. It might be a committee meeting, this and that, until we get into a relationship. We got to date for a while, right? And then the challenge becomes money. There's always going to be the challenge, right? But we can work through that if we're in relationship, to where now, we have a new health center. I think it's a lookalike still at this point, right? Valley Health Partners. Yeah, Valley Health, like Veronica's the homie. If she picks up the phone and calls me, she gets whatever she wants and vice versa. Because I know her heart is in it, and I know the barriers are not her, but
sometimes the system. Yeah.
Yeah. One of them gave you money, so I don't want to say it. Policy folks, right? The barriers are not always the people. I know her heart is in it. I work with them. So it's different. It's different when, your people pick up the phone and call you, man. Melissa called me. I know Melissa. I used to work for Melissa. Like I know where her heart's at. So I'm going to make happen whatever she needs to happen. The same thing with Alicia and the folks over at our third health center. I'm showing up, and vice versa. And vice versa. We got, and I'm still answering the question, right? We got the president of our local hospital on the phone yesterday with another partner, just off a phone call, because we've established that relationship. So that's the challenge. I think the challenge is the relationship, and we'll get there.
I appreciate you saying that, distinguishing when something's, you don't attach a problem or a challenge to a person, but sometimes it's a process or policy or something else. So I appreciate
Yeah,
you
we're
saying
gonna go at that policy heavy. We're gonna go at the decision. I mean, we will. Yeah, I mean, we are advocates. We go hard, but people are human. We don't want to hurt anybody. People have children and families and lives. We don't want to hurt people.
The next question is, and I know we're starting to wind down a little bit. We still have time. So here's the next question. So this person said, I find myself feeling that my agency's mission is to dismantle oppression in our community. But how can we do that when we participated in our workplace? How do you suggest that someone with limited power, in parentheses, a middle manager, can advocate for change within a large organization?
Yeah, man, this question is going to keep coming up. It really is. I mean, institutions, and you've been there. I've walked that journey with you, right? Like you've been there. This question is going to keep coming up. We do hold power. These institutions do harm, like a lot of it, and they break us down every day. You know, I would go back to self-care, have a strong support system, have activities, know when to walk away, and being realistic. Like there are the small things that you can do. And holding people accountable. We have to be able to say, this is our mission. Because oftentimes they're our espoused values, but not our values in practice. And someone has to kind of hold us accountable. Somebody has to be courageous, man. And we have families to feed, so it's hard. But that's the reality, is that we oftentimes have people that are so disconnected from the work that's being done at the top, that we're suffering in middle management because we're trying to protect the people below us from being oppressed. And we're carrying all of it, right? So I said many of us are wounded healers. And when we're wounded healers, we have to recognize the trauma that we carry, right? Oftentimes intergenerational, like this historical stuff that's in our DNA. So, I mean, not to talk about epigenetics, but like it runs through our blood. And then there's the secondary and vicarious trauma that we're exposed to when we see the way people are treated, when we see people being overworked. Right now in this moment, we haven't even talked about the reality of this moment and the pain and suffering that healthcare providers are experiencing. Like, that's real. You're watching people that you care about be overworked, be undervalued, be disrespected, be put in harm's way, and you have to witness that. So how have we stepped up our self-care practices throughout this?
Thank you. So I have a question here. Do you have any book recommendations to learn more about radical welcome?
We're right in it now. So we have an article that just came out. We have my TED Talk. We have a book about to drop, actually. I don't even think I gave that to you, Eureka. I gotta, I'll send you guys. If you put Boland, BOWLAND, Barnes and Nobles, it pops up and you'll see my name on it. I'm one of the editors on a book that's coming out in April. I'm supposed to know the name of the book, right?
We'll get that out to folks.
Yeah, I'll put it in the chat.
Okay.
It's called Beyond Equity. The title of the book is so this will tell you a little bit about radical welcome and some of our work, right? It's called Beyond Equity and Inclusion in Conflict Resolution, Recentering the Profession. Beyond Equity and Inclusion in Conflict Resolution, Recentering the Profession. And my TED Talk will give you an overview of it also. And then, like I said, we just published an article, and we're going to be putting a lot more work out because we really want to change the canons of knowledge. We really work towards, we do a lot of training in groups with physicians and nurses and health centers because it's needed, man. People need support to do this work. It's not a one and done. So I would say we have to invest in budgets of value statements, right? So just look at your budget, right? You guys that are in a leadership position, look at your budget and see what you're putting into training and development, see what you're putting into coaching, see what you're putting into support, see what you're putting, and really reflect on it and think about what are some ways that you can invest in moving the needle forward. Beyond Equity and Inclusion in Conflict Resolution, Recentering the Profession.
Thank you. All right, so let me see. So can you speak a little bit more on specifics on how you find and invite community members to join the cause or the work at PNLB?
Yeah, thank you for asking that. Right, so I just really brushed over it, right? So we have this idea of passionate invitation. So there's two parts to the passionate invitation. One is the individualized invitation, and that's the direct call, that's the direct text, that's a direct message through social media with someone that's in relationship with them. It doesn't have to be a direct relationship, but just to say, so say we're having an event coming up. Hey, we'd love for you to come, need you in the room, love to have you. It's literally just asking people. I mean, whether you're talking about philanthropy, whether you're talking about volunteer, whether you're talking about dating, people say, if people ask, they'd say yes. So it's literally asking people and being willing to hear no. I mean, that's the biggest thing, is we ask and we invite people to be a part of our tribe, to be a part of our work. So that's the first thing. Passionate invitation has two parts. It's the individualized ask, and the second part is the general ask, right? So the specific individualized one, and then there's a general one. We use social media, we use flyers, we use billboards. We really use this public health awareness campaign when things are going on, to invite people into create a space that is known for welcome, that is known for people belong. We have a weekly lunch and learn that people attend. I mean, pre-COVID, I mean, we come from a community where people said, oh, I can't get 10 people of color in a room or 10 parents to show up. We get hundreds of people. So I'm talking about like 700 people to events, 300, 400 people to events. And it's through that. So the methodology I use before we get to those invitations, I'll explain, is connectors, attractors, and influencers. Anything we're doing, and this was even when I was at the health center, right? We were doing time banking, whether we were doing parenting groups, whether we were doing prenatal groups. I'm looking for the connectors, the influencers, and the attractors. Those are the three folks, the three type of folks that I'm looking for, that I'm doing one-on-ones with. I'm a community organizer at heart. I'm doing one-on-ones with them because I know, I mean, I'll give you an example. This guy, Keefe, that's doing some nonviolence work with us, right? I know that if Keefe says no guns, 50 youth are going to follow him and say no guns. Like he's just an influencer. If Keefe, I mean, and we got this from, well, whether we're talking about condoms, whether we're talking about needle exchanges, whether we're talking about, we're giving out Narcan, we're doing, like, that's where it comes from. If Keefe says, yo, let's carry this Narcan, I'm gonna have 50 bloods carrying Narcan and care about it and use it because we're connected with the influencers. So you don't need 100 people to get 100 people in the room. You need 6 people to get 100 people in the room.
That's a very good reminder. Thank you.
Yeah. That's the methodology. So if Eureka said, hey, Hassan, I need 500 people to show up, I only need about 30 people to get those 500 people in the room. And if you're using social media, you look for people to have 5,000 plus followers on Facebook, 4,000, 5,000 on Instagram. Like, there's ways to do it. And then we use traditional print media for folks to do that.
Great. I think we have time for one, maybe 2 more questions, and I think the rest we'll answer. We'll type in those answer. But the next question that I want to ask is, how can staff help community members do their part in improving their health when in economic distress, when there's family problems, housing, all sorts of problems? So how can we engage with community members? How do we engage them in their health and their well-being when there's so much going on? So what are some things that you've seen that you've been able to do with your teams? And I'm also thinking about when we worked at NHCLV and we worked with the super utilizers group. And it was interesting to see that many times caring for people and just listening to them and affirming them, highlighting their strengths, highlighting their gifts, was really the magic in having them care about themselves. I can't remember how many people would say, I care about myself now because you care about me. And I'm talking about when they were working with, Elisa and Lucy and all the great folks. So I thought that was very interesting that it took many times. It was just, we cared for them and they started to say, oh, I'm going to take care of myself. Again,
I was going to say the same thing. I was going to say the same thing. When I started in that work, we had this lengthy intake forms and all of that. And I narrowed it down to 2 questions, you'll recall, right? Yes. One was, what does wellness mean to you? And the second was tell me about your best friend. Those were the only two questions that I asked. And initially nurses were going, wow, like this social worker came in and he changed everything. He did something innovative, right? What does wellness mean to you? Because that leads me to listen, Eureka, you just said it.
Mhm.
I'm gonna listen to your response. And the second is tell me about your best friend, because we know isolation kills. So if somebody can do, if there's one thing that I would ask someone to do, I would hope for someone is that they have someone that loves about them, that they care about, that they believe in, and that they communicate with, right? Because again, I said we are each other's medicine, man, and healing occurs in authentic relationships and in community, and it leads to, I get my health care because my daughter and my wife are on me about it.
All right, well, I think we're right at the end of our chat, and I can't thank you enough for being with us today, but for just your leadership and your passion, and for really bringing to life what I learned from you, the Ubuntu concept of I am because we are, and we are because I am. So thank you, Dr. Batts. At this point, I'm going to hand things over to Bethany.
It is a pleasure to be here. Thank you, Rick. I appreciate you. I love you, man. You my homie in my heart. Thank you, man. Thank you guys too.
Thank you so much, Dr. Batts, and thank you, Eureka, for moderating an awesome discussion. So this is a very quick transition. We're going to go to the next slide so that we can tell you all about the next. You're going to hear from SDOH Academy faculty, Colleen Velez and Tanisha Harris. Colleen, all yours.
Thank you. And thank you, Dr. Batts. That was wonderful. But we want to take a quick minute to now talk about what this innovation showcase is all about. It's just been wonderful to hear about all the innovations that has been happening in the community that Dr. Batts works in, but we know, and I've seen in the chat, and Bethany has reiterated, you guys have been doing innovative work, particularly in this past year, and we want to hear about it. So what this showcase is, and this is innovative for us in the SDOH Academy, so we're excited about it as well, is that it's an interactive training opportunity that incorporates elements of a competition for health centers to showcase what their innovations are. You know, it's an event where people can share a solution of an unmet need around social determinants of health, you know, an opportunity for health centers and HRSA to see and learn innovations from the field, and really wanting to hear from you and the work that you've been doing around SDOH, whether it is something you're thinking about, whether it's something you've been doing for a while, whether it's something that you're looking to enhance upon. And the entire experience is here to try to spark that and advance innovations around SDOH within the health center community and within your communities at the end of the day. So again, it can be something that's aspirational that maybe you're just talking about, or it's just in the back of your brain. It could be something that your health center has been thinking about doing. It can be an activity or a program you've been doing, or an enhancement to that. But what we want you to do is take part in this work and take part in the showcase and bring it forth to us so we can share it with everybody else. Next slide. This is somewhat of a series. It's 5 parts. Today is part 1, this live kickoff, the spurring of innovations. But then part of this is a 3-part module. They're kind of micro trainings that help also think about different things around SDOH, learn some innovative practices that may be happening out already, how we're thinking about SDOH, different subpopulations, how everybody is affected within that. So there's 3 micro trainings or modules that we are going to ask people to go through to complete. You know, the first one is designed to help health centers understand how economic and environmental and educational factors are social determinants of health. 2 is focused on how age and race and nationality and gender feeds into social determinants of health. And the last one talks about the role of data and technology in SDOH. Again, they're not even 20 minutes long. You can go through those, just kind of help think about different innovations, think about how you're doing some of the practices in your work today, and help spark what some work you might want to be doing in the future. And then the series will wrap up with a live webinar that will be happening in May, where we'll be going through all the wonderful submissions that we get. So it's really going to be the showcase. The last part will be the showcase. So this is kind of how the showcase series is going to work. These are the pieces that we are asking health centers to engage in and be a part of, all ending with the live webinar in May to kind of hear what you guys have been doing in the field. Next slide.
So what is next? So after today's kickoff session, you will have the opportunity to view 3 pre-recorded micro training modules that Colleen was talking about. You will have an opportunity to receive a certificate of completion to document your foundational knowledge of the social determinants of health. And again, these modules are organized around Healthy People 2030 goals. They are short 20-minute videos with 3 content-related questions each. Once you complete the post-test and the evaluation, your certificate will be available immediately for download. So as you can see on the slide, you can visit cme.bu.edu/SDOH to access the training modules. We will also be linking this on our Social Determinants of Health 2022 Innovation Showcase Competition landing page, and we'll also have them linked in the slides and also in the chat box. Next slide, please. So how do you submit your innovation? After completing this micro training, you'll have the opportunity to enter an abstract to compete for an opportunity to be featured on a live national audience webinar showcasing your innovation, the last one that Colleen talked about. Innovations must be submitted no later than March 18th by 6 p.m. Eastern Standard Time using the competition submission form found at, and I think that link is listed there, but we will also make sure we will put it on in our chat box and on our website as well. The form does not save your answers, so a worksheet is provided on the Social Determinants of Health Academy website. The winner of each category will be announced on April 14th, and all winners will be featured during the Innovation Showcase closing webinar on May 12th, 2022 at 3 to 4:30 p.m. Eastern Standard Time. So all entries that are submitted will be shared on our website. So be sure to visit the website to learn about all of the great work that's going to be done at our health centers. Next slide, please. So the schedule of events, this slide is just a visual of the timeline for the showcase. So starting today was our kickoff webinar. And as we mentioned, all participants of today's session will have until March 18th to complete the training modules and submit their innovation in the form of a video or a brief document. And submission categories are directly related to those 3 module topics that are around Healthy People 2030 goals. All submissions must include a short description about the highlighted issue or innovation. And of course, more information can be found on the submission form linked on this slide. After all submissions have been reviewed, the winners from each category will be notified mid-April. And as we saw on the last slide, the winners and all submissions will be celebrated in our closing webinar session in May. Our Social Determinants of Health Academy website is a great resource for additional details on the Innovation Showcase, but it also contains recordings and slides from previous webinars, learning collaboratives from our group, and learning collaboratives from our group of NTAPs that have been hosted over the past few years. So we hope you'll check them out. Lots of information that we just shared. So we're going to jump into questions about the showcase. Back to Bethany.
Thanks, Colleen, and thanks, Tanisha. So let me check the Q&A, and we'll have Catherine Stinton from the National Center for Medical Legal Partnership team. Let us know if there are questions from the audience about the SDOH Academy Innovation Showcase competition. So audience members, just reminding you, this is where you get to ask questions of those of us who are faculty on SDOH Academy. Let us know, what are your questions about the competition aspects and the modules that are pre-recorded mini micro trainings that are made more accessible. Type your questions into the Q&A. We'll also keep an eyeball in the chat just in case that's where you've typed in some questions. Tanisha, and I'm looking for on the Zoom screen here, Colleen, one of the questions that came in pre-registration is who's eligible to compete, and do you have to, as a competitor, or rather, do you have to compete in the competition at all? Do you have to enter an abstract in the competition to be able to take advantage of the trainings? So Colleen and Tanisha, do you want to take either of those questions?
I can answer what I think is correct, which is you do not have to compete to take advantage of those trainings, right? Those are trainings, those modules are available to you. You can go in and watch them. What you do have to do is fill out the evaluation. There's like a 3-question part at the, or 3 questions that you need to answer at the end of them to be able to compete. So, that's number 1. I think number 2 is that the goal for this is to be related to health centers. So you yourself might not be a health center, but if you are in partnership with health centers, that you're working through innovations, we would want to have that health center connection and that tie-in and have that piece to it. So 1, you don't have to, you can take advantage of those. You have access to those through the website. And 2, we would want, for those who are competing, to at least have a health center connection in whatever the innovation you're trying to show and trying to highlight.
Thanks, Colleen. Let me see if there are any questions. Catherine, let us know if there are any questions either for Tanisha, Colleen, any SDOH Academy faculty, or even Dr. Batts, since he's still online. I see that he's actually been taking some of the questions that went into the Q&A feature. Catherine, do we have any other questions coming in?
The only one that I've seen so far is whether or not the slides will be available on a specific site. I know Claire said that they will get a follow-up email with the information, but they just want to know where they can find the slides.
Yep, that's right. So we'll make sure, thanks, Catherine. We'll make sure we pop a link to the SDOH Academy website again. In addition to being a link being provided on the platform where you can find the modules, for the micro trainings, which have officially launched today, you will be able to find right there in the chat the link to the SDOH Academy website and the webpage for the Innovation Showcase competition. We'll be sure after this video renders and it's edited and cleaned up that we post a link to this particular session today, as well as the slides in both places, the SDOH Academy website, as well as the platform for the micro trainings, the modules that we've created. So look forward to seeing that. And then what Claire Grimble and her team are going to be doing is also the Zoom platform will send out a couple of follow-up emails for all of you live attendees and those who registered and weren't able to join us live today. Make sure if you're entering an abstract into the competition, you check off the box that will ask you if you attended this webinar on January 13th, because it's a part of the requirements to make you eligible to submit an entry into the innovations competition. We want to make sure that the training and technical assistance aspects of our work here on behalf of HRSA is being carried out and you're participating in those trainings, this one included. So you'll be able to find it on the website. Thanks, Catherine, for popping the link into the chat, and we'll make sure that in the follow-up email, you all will receive all of this information. I think that's it for questions. Catherine, is that right?
Yep, I am not seeing anything else at the moment.
I have a question, Bethany, that we might want to just be able to put out there. So when people go to this website, will there be contact information of somebody that they can ask direct questions to directly once they start diving into this work?
Yes, in several places you'll find on the SDOH Academy website email addresses for how you can reach contacts. So if folks use the link that Catherine put into the chat for the innovations competition and you scroll down, you'll see that our National Center for Medical Legal Partnership project lead Danielle Rahajasin, her email address is in there at the bottom of the website. Also, when you go into the modules, there will also be contact information for who you can reach if you need any sort of assistance once you get to the modules platform. So be sure to utilize The contact information you see there, and then the entire SDOH Academy faculty, the 18 national training and technical assistance partnering organizations will be fielding those questions, supporting each other, and making sure that the field receives the information they need to be able to carry out all of the trainings and submit their innovations for us to be able to highlight. I think that answers the question. And I also see that Claire put into the chat the contact email for any technical issues while utilizing the modules. It's cme@bu.edu. Any other
Bethany,
questions?
We did have a question come in. It is, do you need to be an FQHC or lookalike, or are there other community-based primary care options that are eligible?
Yes, so while the priority is for us to reach out to and hear from FQHCs as well as health center lookalikes, we'll also be accepting innovations from PCAs, HCCNs, civil legal services, social services, DV provider partners, so long as you have that connection to the health centers or your innovation directly impacts the health centers or the health center community. So there are going to be a lot of different eligibility categories, but make sure at the end of the day that your innovation is connected to health centers and the health center community. Is there a contact for next steps? Yes, what we'll do is we'll go ahead and put the ncmlp@GWU email address into the chat, but look out for, as that question came in from an attendee, please look out for the follow-up email that's going to come to all registrants and all attendees, because there will be information in there, and then you are welcome to reach out again to any one of us on SDOH Academy by sending an email to ncmlp@gwu.edu, and we will, as NTAPs, work together to get your questions answered. Any other questions before we wrap up for today? You can go to the next slide just to make sure everyone has the information on the screen. Speaking of next steps, it was a very well-timed question, who to contact. Just a reminder about those next steps. Before I go into the next steps, there's one more question that just came in. Is the certificate available to everyone who takes the modules but does not participate in the competition? Yes, yes, yes. And while we absolutely wish we could have been able to offer something like CUs, not everyone is even eligible for or required to get some sort of credits because maybe you're not a JD or an MD or otherwise requiring some certifications and credits along the way. So this is not a CE related course, but everyone is encouraged to, even if you're not participating in the competition, take part in the micro training modules, receive that certificate of completion. That way you receive some certificate to show that you received baseline foundational core information about the social determinants of health, as we've aligned it with the Healthy People 2030 goals. So please, 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 yes, you can take part in the modules without having to enter the competition, and we certainly hope you do. Those modules have officially launched. If you go to the website, they're now live, and you can access the module website with the micro trainings. So that from now through March 18th, you are welcome to take part in those modules, and then strongly encouraged to let us know by March 18th how you've been innovating in the field. Count everything you've been doing over especially the course of the pandemic to really meet the needs of your communities as an innovation. Most of us have not been around for 100 years and done this before, so please don't discount the value or ingenuity of the delivery of services that you've been providing for the health center patients. And then to what Dr. Botts explained, even in terms of supporting staff and yourself as we all get through this together. From April 14th, from March 18th through April 14th, we will be selecting winners to be highlighted on that showcase competition, but everyone who submits an abstract will be featured in a compendium resource available on the SDOH Academy website. So look out for more. Everyone who joined us and registered today is pre-registered for the May 12th webinar event. We sincerely thank you all for joining us today. We sincerely thank also our special guests, Dr. Hassan Botts and Eureka De La Cruz, as well as Colleen Velez and Tanisha and all of the SDOH Academy faculty who poured all of their efforts in to truly carry out a new event for us here on Social Determinants of Health Academy. Join us on the modules, in the competition, and then on the showcase webinar on May 12th. Thank you and stay safe, everyone. Have a good day.